Good afternoon, class. This is Yvonne Waneki doing a presentation on Cushing syndrome. So first, we're going to look at a case study that was done on a 35-year-old obese woman. She presented to the physician with weakness, mainly in the shoulders and the thighs. She also had increased thirst, headache, easy bruising, menses that were getting scanty, and she was also feeling depressed. On physical examination, she was found to have the moon faces and truncal obesity, and she also had purple striae on the lateral aspects of her abdomen. Blood pressure was 180 over 110. Strength in the proximal muscles of her shoulders and hips were reduced. And then labs were done, and her plasma glucose was 300, so that was extremely high. She also had an overnight dexamethasone suppression test, and the next morning it was 10, which was also high. It was greater than 5. And there was a 24-hour urine-free cortisol, which was 200, and that was also high. Her plasma ACTH was 125, which was also very high. There was a low-dose dexamethasone suppression test that was done, and the urine collected showed 17 OHCS, which were 12 milligrams per day, which was extremely high. And also she had a high dose of dexamethasone suppression test, which came back to be 2 milligrams for 48 hours, and it was 8 milligrams per day, so which showed 17 OHCS of 3.6 milligrams per day, and which was definitely high. Thereafter, the patient underwent imaging studies of the brain and adrenal glands. And that's definitely to rule out any tumors in any of these organs that could also be causing the Cushing syndrome. So now let's take a look at what Cushing syndrome is. First of all, a syndrome is a group of symptoms that consistently occur together, or a condition that is characterized by a set of associated symptoms. Cushing syndrome was named after the U.S. neurosurgeon Harvey Williams Cushing. He had a condition associated with the endocrine system. It is also known as hypercortisolism and is a collection of symptoms that develop due to very high levels of a hormone called cortisol in the body. Cushing syndrome occurs after prolonged exposure to increased levels of exogenous, which is delivered externally, such as corticosteroids, or endogenous, which is delivered internally, which is like producing high cortisol in the body. Most cases of Cushing syndrome are due to exogenous glucocorticoids. In this figure that's presented here shows the main signs and symptoms of Cushing syndrome. And definitely the diagram does a really good justice on actually showing what part of the organs, what exactly the presentation would be for a patient that presents with Cushing syndrome. And you'll see they'll have the moon face, they definitely will have hypertension, striae on the abdomen, bruising. They will complain of osteoporosis. They might have some psychosis going on too, loss of height, and hypoglycemia is also a cause. Decreased skin thickness, tendency to infections, hair thinning, acne, plethora. And so definitely it's a very good demonstration on the signs and symptoms that you will see in Cushing syndrome. So the tools used to diagnose Cushing syndrome, definitely you need to have a physical examination and a very detailed history, 24-hour urinary free cortisol, blood test, a late night saliva cortisol, which it shows that the cortisol is high in the morning and it's lower in the evening. So if you do a saliva test of cortisol in the evening, then you want it to be lower. If it's higher, then that's a concern. Also, a CT scan or an MRI scan provides images of pituitary or the adrenal glands, helping to detect if there's any tumors. Treatment and management. So the main treatment for Cushing syndrome is definitely to reduce the amount of cortisol in the body. And then we have drug therapy, which remains an important approach for normalizing cortisol levels. And then we also have surgical treatment, which is a treatment of choice for those pituitary tumors and adrenocortical tumors. And those with persistent hypercortisolemia after surgery can be treated with pituitary radiotherapy. Thank you. I hope this presentation has provided some basic knowledge about Cushing syndrome.